Hi guys, I'm Hallie Palomar, and today I will be presenting health assessment and elimination for Group 4, which is Abigail, myself, Kelly, and Yadira. So for health assessments, upon admission, we have to gather patient info, and with this assessment, we do this to collect the patient's baseline and assess their general well-being. Usually, these health assessments take about 15 minutes or less. Equipments that you're going to need is a stethoscope, a pen light, gloves, and PPE if needed. This is a couple of techniques that we are going to use for our head to toe assessment. We inspect to look at the patient. Usually, we're assessing for symmetry, color, size, position, and shape. Palpating is touch. We're checking for temperature, usually, and for any skin turgor, which is under the clavicle, to see if they're dehydrated. Percussing is tapping gently, and auscultating is done with a stethoscope and to listen to what's going on inside of the body. So, how we prepare is we ensure our national patient safety goals, which is listed right there. And of course, we not provide privacy and make sure that we enforce environmental safety. Lastly, we're going to tell the patient why we are conducting this assessment, how we are doing it, and what this assessment is. So, for the general survey, we're assessing patients' level of consciousness. So, if they're alert or oriented, they know who they are, where they are, what time it is, and why they are at the hospital. We're going to assess their overall demeanor. We're going to see if they are able to articulate their words, and we're going to assess their pain from a scale of 1 to 10 while asking our PQRST. And then for head and neck, we're inspecting the head for bumps, hair distribution, infestation, skin integrity. We're also inspecting the ears for drainage, placement, tenderness, and any abnormalities, as well as the eyes for any abnormalities. We're also asking them if they use any devices such as glasses or contacts. And we're going to make sure that the patient has PERLA, which is pupils are equal, round, reactive to light, and accommodation. For our head and neck, we're going to inspect the face, checking for symmetry, the nose, overall condition, any drainage or patency. We're going to inspect the mouth. We're going to check for moisture, cracked lips, bleeding gums, tongue, swollen tongue. And we're also assessing for odors while we ask them if they're able to swallow or have difficulty swallowing. Then we're going to watch them swallow to ensure that they are able to swallow, and we're going to ask them if they wear any dentures. And then we're going to check the lymph nodes and the neck for a deviated trachea, signs of jugular vein distribution, and swollen lymph nodes. So when we inspect the face, nose, and mouth, we are using our pen light. So for the skin, we are checking for the skin breakdown and the color on the bony areas, which is your elbow, shoulder, hips, coccyx, and heels, which is shown on those arrows. And again, we're palpating, which means we're touching the skin for temperature and checking under the clavicle for turgor, just to see if they are dehydrated. For the upper extremities, we are inspecting their range of motion, the symmetry, their ability to perform ADLs, which is the daily living activities, swollen or stiff joints, and then pink nails or clubbing in the nails as well. Then we're palpating for the IV site, checking for tenderness and warmth. We're checking the radial, brachial, and ulnar pulses bilaterally, noting what type of pulse is it. Is it +1, +2, or is it absent? And we're checking for their muscle strength bilaterally, as well as the capillary refill in their fingers, which must be less than 3 seconds. So for the thorax, heart, and lungs, for the front side, which is the thorax, we're checking for symmetry, bruising, surgery, scars, how they inhale and exhale, and if they are using any accessory muscles, which means they're having a hard time inhaling and exhaling. We're going to palpate the chest wall for tenderness, and we are auscultating the heart sounds for 1 minute. And then we are going to be auscultating the lung fields in 6 different places. After, we're going to ask them a couple of questions regarding tobacco use, respiratory conditions, cough, mucus production, and use of oxygen at home. We turn the patient over to their back, and we are inspecting for position of their spine, bruising, scarring, skin breakdown in the coccyx and sacrum area. We are checking the back by palpating for tenderness, including the costovertebral, which is where the ribs and the spine meet. And then we're auscultating in 8 different spaces, avoiding the bone. Moving on down to the abdomen, we are assessing the GI and the urinary tract. So for the abdomen, we're checking for bulging, masses, distension, bruising, any tubes or drains, any scarring. We're auscultating 4 quadrants. So we're starting in the right lower quadrant and then we're moving our way up and back down in a clockwise manner. And we are checking for hypo, hyper, or normal bowel sounds. Then we percuss for the same 4 quadrants, checking for any dull or tympanic sounds. It's really important to have this order, which is inspect, auscultate, percuss, and palpate. It has to be in that particular order. It cannot be out of order. After we percuss, we palpate the quadrants for any masses or tenderness, and then we ask them if they have any nausea, vomiting, difficulty eating, their last bowel movement, what color, what it looked like, how often they have a bowel movement. And then we're moving on to the perineal area, still ensuring patient privacy for skin breakdown, presence of Foley catheter, and its overall cleanliness. Lastly, we ask for any presence of pain with urination, blood in the urine, dark colored urine, foul odor, and how often they urinate, as well as if they have any hesitation or burning with their urination. Moving on to the legs, which is our lower extremities, we are inspecting for symmetry, range of motion, muscle strength, hips, stiffness and pain in the hips, the skin color, temperature, bruising, skin breakdown, and hair distribution. And I say color, it means we're checking if there's any jaundice, means they're turning yellow, or cyanosis, or if they look very pale. And we are also inspecting the calves for heat, redness, or swelling. We're also checking the feet for its overall condition, including the heels and the ankles for the skin breakdown, as well as the nails. Now, don't forget to palpate for edema. It could be either pitting or non-pitting. Make sure to make a note of that because it indicates if the patient has any electrolyte imbalances. Then we are going to be palpating the pulses, the dorsalis pedis and posttibial. If needed, we're also going to palpate the popliteal pulses, and again noting if it's +1, +2, +3, or absent. We are going to be palpating the toes one more time, checking for capillary refill, must be less than 3 seconds. Then we ask them if they have any trouble ambulating or if they use any assistive devices such as a cane, and if they have any problems with their balance, also known as gait. Lastly, we ask them for a suicidal ideation, which is, do you have the desire to hurt yourself or others? We ask them if they have any history of abuse, if they feel safe here or at home. We conduct a MORSC fall risk. We assess where they are on their level of fall risk. Red is obviously like the highest and green is the lowest. And before we leave the patient, we have to ensure safety. So the bed is at the lowest height, brakes are locked, side rails are up, 3 out of 4 recommended. Call light is within reach, then we wash our hands, dispose our gloves per CDC guidelines. But before we move on, click pause on this video. Basically, these are the different organ systems that are being assessed when conducting head-to-toe assessment. And just a little fun fact, just to make sure that you're still there, the liver is the largest internal organ. So if you did not know that, now you know. Every human has had a bowel movement before, right? When you are having a bowel movement, solid or semi-solid waste becomes excreted from your body. This is because of the digestive system, which starts at your mouth, then it makes its way down to the stomach, where food is being broken down into smaller pieces, then eventually it passes through the small intestine, then makes its way to the large intestine, also known as the colon, and that's where water and salts are used to turn into smaller pieces of food, which get turned into stools. The stools are moved by peristalsis and fluids that help move the waste towards the anus. The sphincter relaxes and signals your body that it is time to go. Next is urinary elimination. The purpose of this is to discard waste from your body, just like the bowel elimination, and it regulates blood volume, blood pressure, controls levels of electrolytes, metabolites, and also regulates your pH level of the blood. The kidneys filter the blood in their nephrons and remove waste in the form of urine. So if you want to promote your urinary and your bowel elimination, what you can do is you can drink plenty of water. Water will help excrete urine and waste from your body. And if you want to have a good bowel elimination, you want to avoid caffeine and alcohol. You want to exercise and increase that fiber in your diet. So I know we talked about how to promote your bowel elimination. However, there can also be issues in a patient's bowel elimination. Diarrhea is loose, watery, frequent stool that is the most common in the US. When a patient is having diarrhea, a nursing recommendation is the brat diet. The brat diet consists of bananas, rice, apples, and toast. Basically, when a patient has diarrhea, it is important to make sure that they are getting electrolytes and fluids, because through diarrhea, the patient will lose their key electrolytes, which is magnesium, potassium, calcium, and sodium. So constipation is the opposite of having diarrhea. It's the inability to have a bowel movement or having difficulties having a bowel movement. However, because it's very common, it can usually just be relieved by increasing fluids and fiber in your diet, as well as over-the-counter medications such as Metamucil. Some patients have chronic constipation, and it could lead to serious complications and even sepsis or death if left untreated. So, some other conditions that can affect bowel patterns is diverticulosis, which is where small sacs form in the colon. Another one that's very common is IBS, which causes inflammation and ulcers in the large intestine, also known as the colon. And another very common one is Crohn's disease, which is the inflammation of the GI tract and can commonly be found in the small intestine. We really hope that you enjoyed our presentation, but before you leave, we have a couple questions for you. Once you are ready to answer these questions, please go ahead and answer them in the discussion board. So, number one is, why do we conduct a health assessment? And number two is, what are some of the nursing recommendations to promote bowel elimination? These are our references, and we hope you have a nice day.